So long before I wanted to be a doctor and knew I needed to protect my brain, I was an idiot who skateboarded without a helmet. Usually went pretty well, except for the few times that it didn't, like when I tried to ollie over a crate, got my wheels caught, and went headfirst into the concrete, knocked out cold. When I finally came to, my eyes didn't work together anymore. I couldn't see cars coming at me, just static images and blurry pictures. So I walked home arm in arm with my other friends at the time and tried to hide it from my parents. Didn't go well. So I do a lot of work with folks after car accidents in my line of work here. And the question I get the most is it a concussion? So let's go through what the most important signs and symptoms of concussion are that I use when I'm diagnosing my patients. So when I see a new patient, they always fill out what's called the Rivermead Post-Concussion Symptoms Questionnaire, or the Rivermead. This is a questionnaire that is used to screen for concussions. The screening test rules them in here. It's going to tell you if it's likely on the table. It doesn't diagnose it. It uses your clinical judgment for this one. Before I even bother caring what the answers are on that test, I ask the patient, were you knocked out or do you have memory issues around the time of the event? You have those, you're basically automatically having a concussion. If the person says, no, I actually was just in the accident, I bumped my head or didn't, and I'm having these symptoms, all right, now we get into the actual screening questionnaire. There are a lot of items on that questionnaire, and not all of them are as useful as the others for diagnosing a concussion versus some other causes. Case in point, sleep disturbance is very commonly reported after concussion, but it can be caused by other factors too. If you're in a car accident, you're going to have pain and anxiety. Those are going to absolutely affect your sleep, even if you don't have a concussion. So the items I look for the most here are going to be ones that are going to affect your vestibular system or your visual systems. Blurred vision, double vision, dizziness. Those are going to be the things that tell me you most likely suffered a concussion here. Dizziness has many different meanings and interpretations. When you're going into the emergency room or seeing a doctor like myself, we're going to probably ask you a quick question to separate different kinds of dizziness. Is it a room spinning sensation? Or is it a I sit up too fast, I'm going to pass out sensation? The former, that room spinning, that's dizziness. That is an inner ear vestibular kind of issue typically. The I'm going to pass out dizziness, that's more a blood pressure issue. And that again can be caused by other things besides a concussion. If you have that vestibular room spinning, I feel like I'm seasick, walking on a boat kind of thing, that's vestibular. That means you probably have a concussion. Other really important symptoms here to look for are going to be cognitive processing issues. In other words, you're having trouble with concentration, taking longer to think, you're more forgetful, mental fatigue, as in your brain battery runs out quickly. Similarly, if you have any sort of sensory overload kind of symptoms, meaning that you're sensitive to noise or you're very irritable in the context of overstimulation, those are all signs of the brain cells not working appropriately. Again, concussion. Don't go diagnosing yourself with a YouTube video or a simple questionnaire off the internet. If you have any sort of head injury, you should get screened by your doctor here for something more serious.